What's up, bro?
Hey, brother.
How you stay?
Well, today could be better, but for the most part, it's okay. It's okay.
Let me get my stuff put up here so I can read the comments. Oh, we get our loyal viewers are here already, waiting. I love it. How you guys doing, everybody? Welcome, Aloha Monday, brand new week. All kinds of stuff going on. It's just another Monday, man. Start of man, Charlie. Is it flying by for you too? Time.
I'm, in a way, I've been thinking.
Man, it's
I
like
mean,
for me,
I
it's
mean,
flying.
maybe it's just, at age 62, I'm looking at life expectancy, right, of at least 80, hopefully. Even though both of my parents, they died. My dad, he was 58 when he passed away. My mom was 74 when she passed away. So I'm looking at a life expectancy of at least another 12 more years. But I guess the reality is now hitting me that, you know, I just got to make the best of it because nothing's guaranteed from, when you're in your 30s and 40s, you say you're going to live forever, right? You're planning more years. But the reality is I'm in my 60s. I already went through one open heart surgery. You hear things that they say, well, if you do good, the expectancy is 10 years before you got to go do another one. And, you know, I get to the point, I just put so much stress on just thinking about it that, you know, I can be on the pooper and get one heart attack. Who knows? You know, so
Yeah, well, we're on the back nine, no doubt about it. But we make the best of it, Charlie, and we dedicate the rest of our lives to community service, and we do the best. That's all we can ask for, man. We thank God every day for another day of life. I do that every
mhm,
day. I know you do as well. That's all we
yep.
can do, man. That's all we can do. I see a lot of questions popping up already. Do you think we should go into a second test scenario? Um, we'll talk about that in a little bit. Aloha Mel, did you stop posting our daily cases? I only post the Kauai cases because that's the only accurate numbers that are out there. I don't post the reports because I don't trust them and I don't believe them. Yeah, guys, go ahead and share. We got a great show for you guys tonight. We got two people from the Department of Health. Tonight's focus is please share, guys. Please share, please share, please share. We want to get this word out. Tonight's a very important topic. It's about vaccines. We got two people. We got a state program director for the Department of Health as well as our local Kauai district office person, CJ Johnson from the state office, and Blanca Gil Lopez will be joining us from the Kauai office. So tonight we're not going to talk policy. We're not going to talk about anything other than how are we going to get the vaccine out to everybody and the updates on what's actually going on. As far as the second test scenario, I was just telling Charlie before we went live, I was watching the news today and the CDC director, and I can't, for the life of me, cannot remember her name. You remember her name, Charlie?
Walensky.
Yes, Walensky. She was the one that one day said we're headed for doom. The next day she said it's okay to gather if you're vaccinated. Now she's saying today's message was our national counts, new cases across the country is back up to 70,000 a day and climbing and climbing. And she was saying that the vaccine provides a delayed response to the cases because it takes time to build up I hate to use the word immunity because it's not real immunity, but your protection, it takes a while. She said the only thing right now to catch up, and she's talking about the states that are the numbers are going through the roof, is to lock down back to where we were, because the vaccine alone is not going to stop the virus. So, again, while I agree with her, the constant changing of the message, Charlie, is what's causing some issues. And again, I want to remind everybody tonight's guests are not here to discuss policy. We do have General Hara who has agreed to come on our show once he gathers the update, he's been away for a week in Arkansas. So he's gathering the updated data, and he will be coming on our show. Hopefully this week, we will, whenever he's ready, we will have a special edition. So tonight is really just about the vaccine and the strategies. But Charlie, no different, man. Nothing changes. You watch the local news, hey, como mai, welcome, open up, HIPAA, whatever. There is no indication of concern from the governor or the lieutenant governor as it relates to the dangerousness of this virus and the variants. None.
Well, I find it very, very disturbing, but it's, sometimes the news is so nonchalant that Michigan, for example, right, 246 cases reported of vaccinated cases, and 11 out of the 246 required hospitalization. They contracted the COVID after being vaccinated, and 3 people died after they were vaccinated, but they still died from COVID. And I don't, for me, it tugs at my heart because those people are not alive to tell us what happened. So I think these experts, they got to be a little bit more compassionate in that, we're trying to put things together really by speculating. Maybe that's not a good thing to do, but we have no other choice. There's nobody else seems to be wanting to be a good neighbor and give information out there. Nobody wants to. So I just read where a year ago, those individuals that participated in the study are now being given the 3rd booster shot to fight the variant. It's being applied to them. One, I'm very happy for them because they were the initial test subjects, right, for these vaccines. And I'm happy for them that they're getting the booster shots. Now we just got to wait and see. The question is, while we're waiting to see who gets the 3rd shot, there are some people within our communities that still haven't gotten the 1st shot. So what the heck? I just don't get it.
The vast majority. If you think about it, we're at about 30, maybe a little over 30% of fully vaccinated people here in Kauai, 20+% in the state. So yeah, and hopefully we'll get more of that data tonight. But you're right, Charlie. It's not making sense. You don't get a straight answer. Again, if you listen to our leadership here in Hawaii, it's all good. It's all groovy. We're all safe.
Yeah.
Just got to wear a mask. And when you listen to the experts in these states that are actually exploding right now, not long ago they were like Hawaii. Not long ago they were like Hawaii. That's the danger of this variant. And there was a woman on the news tonight who is recovering from COVID, and she's begging people. This virus is so bad. She cannot breathe. She's on oxygen. 40 years
No,
old.
the reason why, we have leadership that are totally dismissing individuals like that.
Yeah.
They're looking at her like, you're just one in several thousands. So what you say doesn't matter. That poor thing is lying, fighting to breathe. And I would think that she's just as important as you and I that who can breathe. She's telling us why if you're gonna take risk and you end up like her, just don't cry when you're gonna be struggling to breathe. So I don't think our administration should be talking cheaply right now, because there are people like them that exist out there. Yeah. That even though they haven't fully recovered, they survived it, but the recovery is still part of their overall plan. They haven't achieved their recovery plan.
Yeah, and that's why, when you hear comments like, oh, there's only 40 COVID patients in the hospital, only 40. Only.
Yeah, your dad Thomas, no, we're not saying you got to take 3 shots. We're saying that the 3rd shot is being administered to some of those who took the initial shot a year ago as part of the trials to see if it can head off the variants. That's what it's about. Yeah. So
All righty. Well, Mr. Johnson is in again tonight, folks.
Yeah.
We're not talking about the policy and about the quarantine passport. We're talking about vaccines. And we are going to bring in, looks like we might have both of them.
Yep.
Yep, we do.
You
Awesome.
have to, you have to- Yep, there's one.
CJ,
Gentlemen, what's shaking?
and there's Blanca.
Blanca,
Yeah.
one of my
She's on
favorite
mute right
people.
I gotta tell you, I don't know why. I feel like I know you for a long time, CJ. Not sure why. Maybe because we spoke a little bit the other day. It's like bizarre.
You seem like a friendly guy. I'm a friendly guy. I think you're
Yeah, man. I like the beard. I like the beard. Fear the beard.
you're the beard.
Anyway, I'm Mel. That's Charlie, the Hawaiian up there in the corner. Thank you for joining us tonight to talk vaccine. We're excited. We're here to learn and absorb. So let's get right into it. Our viewers, we'll turn it over to you, CJ and Blanca, and then we'll have some discussion time. We can get some questions from our viewers. So.
Sounds great. So if it's okay, what I would like to do to start is I have a presentation deck. That's the deck that I've been giving around the state for the last couple of months. It changes kind of every time I do it, so I'm always updating it. But I think it's a good, helpful starter for the conversation. Some of it might be really 101 for some folks. I know you guys are really plugged in. I know a lot of your listeners are really plugged in, but maybe some folks aren't. So and it has kind of a lot of basic tenets that we'll talk about, in more detail later. But I do think it's worth starting with that just to clarify some things. So I'm gonna
Yeah, before that though, could you introduce yourself and give our viewers a better idea of what it is that you do in Blanca right after CJ?
What a great idea. Absolutely. Hi. So I'm CJ Johnson. I am the Community Health Outreach and Public Health Education Specialist for the Department of Health's COVID effort. So essentially I work with communities and community leaders to develop strategies for education and outreach to make sure folks have the information that they need to make informed decisions about getting vaccinated.
And Blanca?
Okay, and hello everyone. My name is Blanca Hill. I'm with the Kauai District Health Office, so Department of Health at the local office. I do kind of the same job as CJ, but locally here in Kauai. I work with the bilingual health team, so we work very closely with CJ as well. And that's it.
And the accent, Blanca, what is that accent? It's awesome.
It's from Latin America. I was born and raised in Colombia.
Oh, awesome. Well, see, Charlie,
Yeah.
worldwide, international, Charlie. Our guests are international guests, man. We've arrived.
Next level now.
I'm very honored, and I was born and raised in Hawaii, so that's my accent you're hearing, right?
What about you, Mel? Where were you born and raised?
Right here, my friend.
Okay,
Right here.
okay.
I'm pure-blooded Portuguese, but I think my pops is on the actual, my dad is in Seattle right now, and I think I'm 6th generation or something, so I don't even know that folks. I can't even speak Portuguese. So yeah, I'm just a guava that was transplanted here many, many, many generations ago.
Outstanding. I'm from Las Vegas, which I guess some people call the 9th island. I don't know about that, but we've been going back and forth for a long time. So
My favorite vacation spot.
all right, absolutely.
I
So I'm going to
haven't
jump.
been-
Go ahead,
been there
sorry.
in a long time.
I haven't been there in a long time either. So I'm going to, I know this is a little disorienting right now, but I'm going to get it locked in and just do a little bit. Like I said, I'm going to go kind of, it's kind of basic at the beginning, but it gets to kind of what we're doing, and I think it'll be helpful for table setting. So I do like to start when I present by directing people to hawaiicovid19.com. We have a lot of information there that's really helpful for folks. I think we get a lot of questions about where do I find this? Where do I find that? When in doubt, start at covid19.com. We do have a really good list of the different portals and the different ways that you can register to get vaccinated throughout the state. So that's one of the resources. We also I know you guys know, have a really good data dashboard. And the data dashboard is improving all the time, but we can break down by county. So what you're looking at now is I've actually pulled this right before we started. It looks like Kauai is at 42% initiated, so that's pretty impressive. We are at 954,000 overall doses. I know there's a discrepancy between that and the 730. That includes all of our VA and our Department of Defense and our stuff that's not through our main channels, but that's we're making progress, right? We're doing pretty well. I also like to share this, and this is an NPR graphic of CDC data. If you look, we are right in there. Hawaii is in there. So this is 30%, and this is way down at 15%. We're still doing pretty well. I think there's some criticism, and there's always room to improve, but we're making a dent in it. I think we're moving in the right direction, and I just want people to keep that in mind. I think we get beat up a lot for why aren't you doing this? Why aren't you doing that? I think the vaccine campaign is going pretty well. I'm also really proud of this. My work focuses a lot on outreach to the Native Hawaiian, Pacific Islander, Filipino population in the state. And one of the work products that we have to show for that is a translation, a really, really good multilingual resource library. So almost all of what we put out is available in at least 16, most cases 20 languages, includes all of our East Asian languages, Spanish, and also the Pacific Islander and Filipino languages. So we're really proud. We take it really seriously, right? We know that language can be a barrier to making informed decisions. So we want to try really hard to make sure that folks can do that. If you're interested in staying up to date on kind of the latest and getting updates, you can subscribe to hawaiicovid19.com. We don't spam you. We send out a thing once a week that says, here's what's happening this week. Here's the new information. We're pretty active on social, Facebook, Twitter, such and such. But subscribing via your email is a really handy way to do it. This is a new one. We just expanded our level of service for our 211 Aloha United Way service that now supports Kapuna Vax registration. So for folks that want to get registered, want to get vaccinated, but aren't comfortable with a computer, they want to do it just by calling somebody on the phone. You can call 211 and they will connect you with the best place for you to get vaccinated. They'll also help you if you need any supportive services, like if you're homebound, they can connect you get you in line for that, or they can get you rides to a facility if you need to get transportation. Have transportation concerns. This was a big one. Blanca and I were both involved in this. This is a really big project. Sorry about that. I'm in downtown, so a little bit of siren action going on there. We have put together a really, really intensive Hawaii home care for persons with COVID guide. This again is available for download at our website. It's 50 pages of really, really good info. That's everything you could possibly need to know if you or somebody in your household is diagnosed with COVID. If it's not severe enough that you need to go to the hospital, this will tell you how to take care of yourself, how to take care of that loved one. A lot of love went into this. We also have it available at Ilocano, Tagalog, Shukis, Marshallese, and Samoan. So that's great too. I do want to remind people also, we have a lot of information out there. We're working with healthcare providers, TV, radio, folks like you, community partners to spread the word. So stay plugged in. I know people are always saying, where do I find the latest information? We're putting stuff out really frequently. On the other hand, there is also a lot of bad information out there. There's scams, there's bad information about vaccines and rumors. The internet has made it really easy for people to spread falsehoods that look and sound really credible and professional. So what we tell people is to always be skeptical of rumors without sources or studies behind them, or claims made by celebrities who are not health or medical experts, information shared by someone trying to sell you something that will cure you of COVID, or anybody claiming to represent the Department of Health who is asking for your financial information. We'll never call you and ask for your financial information over the phone, so please be aware of that. So with those little bits out of the way, here's kind of the 101 stuff, right? I am here to talk about COVID. I do like to start by clarifying, because this always comes up, right? There's some information about what a vaccine actually is. And the really important key here is that a vaccine is something we like to talk about it or think about it like a shield. So it's a shield that you can wear that'll keep you from getting sick in the first place. It's not a cure, right? It won't help you recover faster if you take it after you're already sick. It's something that's more of a preventative than a therapeutic medicine. And the vaccines that are in use right now work in 3 different ways. The first, they reduce the likelihood that a person will get infected if they're exposed. The second is they reduce the likelihood that a person will get sick if they get infected. And the third is that they'll reduce the likelihood that a person will pass the disease on to someone else once they're infected. So those are 3 different benefits, and they all work a little bit differently, but they're all really important. And they contribute to this big goal, right? What are we talking about here? It's that herd immunity piece. So what do we really mean when we say herd immunity? It's when the entire community is immune to an infectious disease, either through previous infection or vaccination. So this is a little graphic that I have that I think makes makes it easier to think about what that actually looks like in practice. So let's imagine that our little red characters in this field are our infectious folks, right? The people that are capable of transmitting the disease if they sneeze on you or they cough on you or they sing too loud near you. And then your blue folks are the folks that have been vaccinated. And then your yellow folks are the folks that have not been vaccinated. Well, if you look at that, not everybody on there, right? We're not at 100% vaccination, but enough of the population has been vaccinated that it makes it very hard for the disease to spread in the community. And when we reach that state, that's the state that we call herd immunity. That's when we know we essentially have the disease under control. Unfortunately, we don't know what that number is yet. I think that there's a couple of big outstanding questions. They'll come to a couple of more of them later, but that what percentage needs to be vaccinated, we don't know. We think somewhere maybe 70, 85%, somewhere in there, but obviously that's something that everyone who studies these things is watching really closely to make sure that we do know. There's 3 vaccines in use right now: Johnson & Johnson, Pfizer, BioNTech, Moderna. Those are the only 3 vaccines that are approved by the FDA, by the US government to create preventative benefits to COVID. There's some others on the market that are coming to the market that look like they're really close to being approved, but that's where we're at right now. That's kind of the state of play. Johnson & Johnson is what we call a viral vector vaccine. And the viral vector vaccines use a modified version of a different virus as a vector to deliver instructions to a cell. So we think of it as like a sheep in wolf's clothing, right? It trains your immune system to defend itself against coronavirus, but it doesn't bite you like the real coronavirus. That virus does not cause infection with either COVID-19 or the vector it uses. And then the mRNA we've been talking about a lot lately, mRNA or messenger RNA vaccines share instructions on how to fight the infection. So that's more like a photograph, right? It shows your body a photograph of the vaccine, or excuse me, of the virus. It says, be on the lookout for this guy if you see it. Neither one of these will cause COVID, and they won't affect your DNA either. We get a lot of questions like, oh, mRNA, does that mean that it gets into your DNA and affects your DNA? No, it doesn't go anywhere near the nucleus of your cells, which is where your DNA is kept, and it washes away as soon as it's done. It's in a very thin, weak, fatty wrapper that goes away, and then as soon as it's done delivering its message, it's done. In terms of comparing them, right? It's a little bit like comparing apples and oranges, because the way that the trials were conducted make it a little bit difficult. There's also the fact that the trials happened at different times, right? So the Pfizer and Moderna trials happened before we saw a lot of these variants that are out, the Great Britain, UK variant, the South Africa, Brazil variants. So those appear to have had some impact on the efficacy level of these vaccines. They haven't made them useless, but they've challenged it a little bit. They're getting around the corners. So when you say straight up, like, how does the Johnson & Johnson compare to that? You know, some people have thought it's unfavorable, but it's really unfair to say. It's hard to say. But I think the big takeaway from all of the trials is that they are all extremely effective at preventing severe illness and death, and it turns out it's looking like they're very effective at preventing transmission. So if you have any of these vaccines, they're going to do the job they're supposed to do, which is keeping you out of the hospital, keeping you from dying, and keeping you from getting other people sick. The other thing I would say is we get asked a lot. I'm sure I do. I know I do. I'm sure Blanca does as well. What's the best vaccine for me? And the best answer to what's the best vaccine is the one that you can get the soonest, right? Get the one that you can get. And that helps our goal of getting to herd immunity before there's more variants. I think that's the thing we want to do, is make sure that we get this under control. Every time it jumps from person to person, that's an opportunity for a mutation. And most mutations are harmless. Some of them are even helpful. But the more times it jumps from person to person, the more people get infected, the more likely it is to cause a mutation or a variant that actually gets worse and causes more problems for us. So we really want to avoid that. Obviously, the Pfizer and Moderna are the 2 shots we've been hearing about. So if you think about it, if you get the Moderna, that's the one that from your first shot, and then another 4 weeks to your second shot, and then another 2 weeks before you're considered fully vaccinated or fully immune after your full vaccine course. That's a full 6 weeks, right, between when you initiate and when you're considered good to go. Whereas with the Johnson & Johnson, your first shot, and then you're good to go 2 weeks after that. So it's a bit quicker. It does have that benefit. There's also the benefit of storage and handling. The Pfizer and Moderna mRNA vaccines have pretty stringent deep freeze storage requirements. The Johnson & Johnson really only requires refrigeration, like medical grade refrigeration that most clinics across the state have. So it makes it a little bit easier for places where the logistics of getting it out are a little bit more tricky. It's 1 dose. Also, obviously, that makes it easy to get out into places where it's a little bit trickier. So the answer is, it's hard to judge them. They're all really effective. There's some logistical benefits to one or the other. There's some speed benefits to one or the other. But whichever you can get the soonest. If you have to wait, we have a lot less Johnson & Johnson, and it looks like we're going to have a lot less Johnson & Johnson for another several weeks here. So I wouldn't hold out for another month to get Johnson & Johnson. I'd start whatever you can get in front of you. And then in terms of phasing and where we're at right now. So we've been going through, the phase 1A, 1B, 1C. We are still in phase 1C at the moment. We just dropped that to 50 and older. Actually, no, that's not true. I'm talking to a statewide audience, and you guys are all Kauai folks, so you're wide open. So at the end of this, we'll hear from Blanca about that. So actually, I'm going to skip this slide because I think we're wide open to everybody. So this doesn't matter as much to you guys. But I do want to say for anybody, if you are listening on Oahu, we are planning to follow the rest of the state's lead and go into phase 2, which is full eligibility for folks 16 and over, starting on the 19th. So next week will be open to everybody. If folks are looking for a place to get, other than our COVID-19 or Hawaii COVID-19 website, vaccinefinder.org is actually a really good place to find doses that are available. I know there's a lot more local info that Blanca will share when I'm done, but we found that to be a really good place for pharmacy partnerships. Those have emerged as actually a really, really valuable resource for us is the retail pharmacy program. It's very low maintenance, it's very low resource on our end. And so anything that takes the burden off of our resources and allows us to focus on populations that are more resource intensive, that require more effort, we're really excited, excuse me, to get folks in the door there. It's really easy to come and go that way. When you make your appointment, it's important to get your first and second dose in the same state, same place. The doses and appointments are managed separately, and allocation is based on population. So if you have travel plans, either delay your travel or delay your vaccination until you can be in the same place for both. It's really important. We get asked that question a lot, like, oh, I'm flying in from California, or I live here part-time, or I live somewhere else part-time. It's a lot easier on the systems if you do the same in both places. You will be asked to wear a mask the whole time you're on site at the site. There's a pre-screening checklist. It's really valuable. If you go to our website, that's another thing you can see on there. You have a good pre-screen checklist of all the questions that they're gonna ask you on site, and it may give you a sense of whether it's a good time for you or not, or whether you have any allergies that you should be concerned about. But it's good to have that, make it a little bit easier for you on the day of. And also, there's no supplements or foods or practices that'll make the vaccine more or less effective. I'm a chronic disease guy, so good diet and exercise will help manage chronic diseases that are associated with a worst case of COVID-19. But in terms of making the vaccine work better, it doesn't really work that way. We have heard people say that being really well hydrated is a good plan for proactively minimizing some of those side effects. And of course, that's a good idea anyway. So make sure you're well hydrated. When you get your vaccine, they will give you a card. If it's a 2-dose, you'll get a card and it'll have a follow-up date on it. For your second vaccine, that'll have a lot number on it. It's important to keep that card. Just treat it like you would any other medical record. We've actually heard a lot of folks say take a picture of it, take a picture of the front and back, so you have that handy. You'll get a card. If it's 1 dose, that's it. If it's 2 doses, you'll come back at the time on there. We do monitor folks for 15 minutes after their injection, and that's really just for any unexpected side effects. Side effects that are not anticipated, like anaphylactic reactions, are really, really uncommon. Most adults who have any reaction or anaphylactic reaction to any ingredients in these vaccines know it beforehand. You've encountered that already. There's nothing in here that's a surprise for most people. There are folks that have said, I know that I have some of these reactions. So when you disclose that in your registration form, they'll ask you to stick around for longer. So for a full half an hour. And we've actually had people say, I know I have an allergy. I brought my EpiPen. It was really important to me to get vaccinated anyway. And they'll just have their reaction and power through it with an EpiPen and then go on. But the idea, it's very unlikely, I should say, that you would not know that you would have a serious reaction, serious allergy to vaccine ingredients and not already know it as an adult. A lot of folks are asking, do you still need to observe the pandemic safety measures afterwards? We are asking folks to, yes. We still expect people and hope people will mask, avoid close contact, 6-foot contact with strangers and people outside their household, and avoid crowded spaces. I know that what we get a lot is like, well, if the vaccine works, then why do we still have to do that? And the way I reply is, it's kind of like asking, well, if seatbelts work, like why do we need to have speed limits? Or if speed limits work, why do we need airbags, right? Everything works, but nothing's perfect. And the more layers of defense we have in the middle of a crisis, the better they'll all work together. So even though it does work, we know it's really effective. It's not perfect. Nothing is perfect. So we just want everybody to hang with us for a little bit longer and continue to observe these best practices until we're in a little bit better ground. On the other hand, we are really excited that we do have some news from the CDC about what's safe. So there have been a couple of updates to what's considered safe and what's considered allowable. So according to the CDC, people who have been fully vaccinated can gather together indoors without wearing a mask. So if you want to go over to your friend's house and both of you have been vaccinated, that's totally fine. The risk of spread or the risk of being part of a transmission chain is very, very low in those circumstances. So the CDC is pretty comfortable with saying that's fine. Similarly, if you've been vaccinated and you want to go over and visit a household that is unvaccinated, it's like a closed household that's observing their best practices, you can go over to that household and hang out and not wear masks. That is, of course, unless there's someone who's in one of those higher risk categories living in that household, or it's a congregate household type setting. But you can go over to your auntie's house, right, and have dinner with them without having to worry about masks. And then the third thing is you are no longer required, if you are fully vaccinated, which again is that 2 weeks plus, to self-isolate if you are notified of exposure. So if our contact tracers call you and say, you know, we know that someone that we have reason to think that you are a close contact of someone who's tested positive, you can say, here's my lot number from when I got fully vaccinated, and they'll check it out, and they will say, yep, turns out you're good, and you're no longer required, you're no longer registered and required to observe those best practices. So that's a nice benefit. Would like to give a quick plug to the Aloha Safe Alert app. It's a peer-to-peer app that it makes it easier for us for the contact tracers to, so it's a little tricky. It's not actually a communication system from the individual to the state. It's essentially a Bluetooth communication system that allows you to know if you have come into contact with someone recently who has tested positive. So it doesn't share that information with us. It just shares that information kind of socially among devices. You can download it as an app and just give it access and permissions. We've had a lot of downloads in the state. I think we're at over 450,000 so far. Here's how it works. I think I have a little diagram. Yeah. So you test positive, your family, you may have been exposed, a stranger gets a notification, but a friend maybe doesn't get the notification because right? You've told them already. We do have it available in Marshallese, Samoan, Tagalog, Ilocano, and Shikese, I believe, are the languages that's available. We're really we're hoping people will use it. I think it's a really valuable resource. So that's the end of the formal presentation. I did want to spend just a minute talking about health equity, if that's okay. We released a report about 3-4 weeks ago called Addressing Health Equity in Diverse Populations. It also is on hawaiicovid19.com, and I would really encourage folks to consider it and take a look at it. I think one of the things that has become made really clear from the pandemic is the relationship between sort of some of the structural barriers that people have to getting good healthcare, to living healthy lifestyles, and the way that COVID has exacerbated those inequities. I work in chronic disease, right? So I normally am working in like heart disease, diabetes, hypertension, obesity, things like that. What that means is we focus really strongly on how things like occupation, socioeconomic status, and living environments either support or create barriers to health. And what we know from this work is that generations of unequal access to supportive environments, to healthcare, to health education, racial disparities in many chronic diseases are persistent and compounding. So we have seen that with COVID, right? We've seen that our rates of COVID in Filipinos in particular, in Pacific Islanders have been much higher than the general population. And we've been really concerned about that's kind of been the impetus for my role being what it is and doing that outreach. But I think the really important thing is that they're not genetic, right? People are not at enhanced risk because of their genes. They're at enhanced risk because of these historic and persistent and compounding disparities in access. So we're really focused on activating partnerships and working together with people to manage those. And we have some really great community partnerships. We've been doing some really great outreach. It's not my face that's out there giving this education. We have community partners, we have faith leaders, community organizers. And that's been a really important strategy. And part of the reason I'm here tonight is to reach out and say, if you are one of those folks, if you're a faith leader, if you're a community organizer, if you work in the Native Hawaiian Pacific Islander community, you'd be interested in getting together and talking through some strategies for how we can address maybe concerns about how safe or effective the vaccine is, we would be really happy to work with you and to prepare some education and to point you in the right direction for where to get that information and where to get it in a language and in a cultural context that's appropriate for your community. So there's a lot going on. We've been doing a lot of really, really exciting work with small clinics. We've been doing a lot of pop-up stuff around the state where we work with a nonprofit or a community group and a faith-based group and just get vaccines and have translators on site, get vaccines in arms right there on site. We've been making some really great partnerships that we hope endure beyond COVID and help us with our chronic disease disparities. So I know I've been talking a really long time. I'll stop. Hawaii COVID-19, quick plug again. I'm CJ. I'll put my info out there. CJ or Christopher Johnson. 3@doh.hawaii.com, and we can put that on Facebook too. But if people are interested in working together on kind of strategizing how we can answer people's concerns, we're not trying to coerce or twist anybody's arm into getting vaccinated, but we do want to make sure that people have good information and know where to go for good information, and that if people are turning to faith leaders and community leaders, we want to connect with them and make sure they know where to go and who to ask for good info too. So I really appreciate having me. I'll turn it over to Blanca, and she can talk about what's going on in Kauai, and then I can hang out, we can chat and answer questions if we want. Thank you.
Thank you. Yeah, we did get a bunch of questions. We'll let Blanca go first and finish up her presentation, and we'll start dropping the questions. We got a very engaged audience.
That's perfect. Yeah.
All right, Blanca.
Great. That's exactly what we want. We want questions. We want to talk a story. We want to make sure we're here to answer as much as we can or follow up with the things that we don't know. I think just to add to CJ, most of the presentation is very accurate to what's happening in Kauai. The only difference is we were open to for vaccinations to everyone 16 years old or older a couple of weeks ago already. So that has helped us move forward a little bit more in terms of the percentage of our population being vaccinated. So it's really exciting. It's really awesome to see that the number we already passed 50,000 people vaccinated in Kauai, at least the first dose. So that's really amazing. And that's only possible because we do have great partners here in Kauai. As soon as vaccination efforts were a little bit more close to us, or the deadline, the timeline was a little bit more clear to us, the hospitals were on board, the pharmacies were ready to get on board too. A lot of clinics were trying to apply to be distribution points. And right now we have many, many options, and we're very, very privileged in Kauai because most people don't get to choose the vaccine that they're going to receive. But in Kauai, we get to choose right now because we do have the 3 vaccines available here. Not infinite amounts of each, but we do have the 3 vaccines here. So if you want to choose by vaccine, you can go and look for each location for the vaccine that you want. Or if you want to choose by location, you can just choose for the place that is closer to your house or closer to work. If you want to do it, during work time or after work time, if you have more time on the weekends and it's easier, so you just go to a pharmacy. That's maybe easier to go during the weekend. If you want to go to your doctor and your doctor is located at a hospital, the hospitals have it here too. So it's basically, we are very blessed, and we get to choose where we go and get the vaccine. That's kind of a little bit of the addition in terms of eligibility here in Kauai. I do want to follow up for the outreach efforts, and ever since the pandemic started, it was really clear to us that those communities that have been affected before by many other barriers, as CJ was mentioning, were being affected also by COVID, not by the disease itself, but by the consequences, like losing their income or being more exposed or having a harder time accessing to information. So we got ready and started doing outreach, and we have a bilingual team. So when you mentioned that this is an international conversation, so I'm here speaking on behalf of the rest of my team, but they're from the Marshall Islands, they're from the Philippines, they're from Ni Hao. So we speak different languages. We have those sort of languages in our staff, and we use that as the main route of communication with our community members. And the other difference is community members are our families too. So it's easier for us to communicate with them in their first language because it's our first language and it's our mother language. So it's been a really useful tool to have, or a skill to have, in terms of communication. So it has been the same for vaccine. As soon as we were able to start reaching out to specific communities, we start reaching out in the first language. It was offered to all of the employers if they had people in their teams who didn't have English as a first language or didn't have access to technology or had a harder time navigating technology, and we will meet them halfway there. And we would try to do as much as we can to help them get their vaccine. And we did, and we still do. If people are hesitant to get the vaccine because they don't know how to access technology, because they don't know how to speak English, because they're not sure they may be eligible or not. Just I guess that's another reason why I'm here. Just know it's not the case. Just knowing Hawaii, we have someone ready to help you with that. And I think I'm much more excited about hearing the questions, the comments. Yeah, and I'm happy to have CJ answering most of those questions. So.
Unmute here. All right. Okay. Thank you, Blanca and CJ. I did have one question about needing assistance on the Big Island from the Latin community up there, Blanca. I do have, I mean, I can share your email addresses, or however, if they want to get in touch with you, maybe you can help. I'll put that up in a little bit so you guys can get a screenshot. But let me just start off with our first question. And it's for either one of you. Will the vaccine rate be fast enough to prevent the outbreaks or potential outbreaks with the variants? As we hear across the country, the variants are kind of taking over. And what's the state's feeling on the rate of vaccination versus the rate of the variants taking hold?
I don't think anybody knows that with any confidence, but I do think that we are still optimistic that we're doing well. I mean, I think with the vaccine rate is going. The fact that we're continuing to move forward with new phases, I think, tells you that we're pretty confident that we are. You know, I think the real. It's always been the case that the bottleneck and the challenge with vaccine is not the internal capacity, but really the supply, right? And for the first month or so, the supply was really inconsistent. We were getting less than we thought we were going to in a given month, and it was very difficult to plan very far ahead. Everything was coming through a central channel through the Department of Health, and now there's a lot more channels. There's the retail partnerships, there's the FQHCs, there's all these different channels. We are, I think, firing very much on all cylinders in terms of our capacity to get this out here. I think there's a good deal of optimism that we are going to be able to keep to stay ahead of variants here. We do have all these, everybody knows, right? We have a lot of geographic and weather, climate benefits the transmission is a lot slower here than it is a lot of other places. And so far, the tone of that is urgent and concerned. I mean, we're watching it, but I do think we also are confident that we're moving pretty quickly and that we're going to be able to stay ahead of the variants. I don't think anybody knows what the end game is, right? I think we want to know. We're all intimately connected to the whole world. There's we can't just be a bubble forever, for better or worse. So we are concerned about the global rate. But I think in terms of what we are doing and are we doing as much as we can, I think we're definitely moving in the right direction.
One question that I do have is, based on what you're talking about is, yes, we are very successful in Hawaii, but because we have opened up the floodgates, how long is that success?
Again, I don't think there's a known answer to that, right? I think there's too much novel information. There's too many things for which we don't have trend lines to say how things are going. I think they did announce that we're moving forward with a vaccine passport that will hopefully make it a little bit, that'll control travel in a way that allows the economy to start moving a bit more, and allows for some mobility, but continues to put a value on that safety piece, on that, the vaccine, excuse me, the travel safety pice, right? But I don't know. I think anybody that pretends to know, where this ends ultimately is probably not very well informed. There's a lot of novel information. There's a lot of new information. I think we're optimistic.
So my follow-up question is, and I'm going to throw information that has been circulated, has been by several different news organizations. And that is, so how does vaccinated individuals, fully vaccinated individuals, get COVID after being vaccinated for a month? How do they get the disease?
Well, that goes back to the car crash thing, right? Like, I think what I said earlier is nothing's perfect, and that's why we wear seatbelts and follow the speed limit and have airbags in our car. I don't think it's ever been I don't think no one has ever proposed that any of the vaccines is 100% efficacious, right? It's never been the idea that they would fully work, they would fully present the disease, period. What they do is those three things that I mentioned earlier, right? They make it very much less likely that a person will get the disease if they are, so there's the virus and you get infected with the virus and then you can get the disease. You can still get the virus and not get the disease and not be symptomatic. And you can still be both of those things and not transmit it. We do know that the people slip through the cracks and all those things. And that's why our guidance about masking, our guidance about avoiding large crowds, our guidance about maintaining social distance are still valid, right? We still want people to wear their seatbelts. We still want people to follow the speed limit. We still want people to keep their airbags turned on in their car. But so that being said, that nothing is perfect. It's better. It's very helpful. It is extremely effective. And I think that's really interesting. There was a story a couple of weeks ago about maybe the exact case that you're describing, but certainly a case like what you're describing. And there were two very different headlines in the local papers, right? One of them was fully vaccinated person two fully vaccinated people get COVID. And the other one was COVID stops hospitalization and serious infection in 2 people. And we still have seen very, very few hospitalizations, if any, from vaccinated people. And it's not impossible to get the infection if you get vaccinated. It's just much, much less likely, and much less likely that once you do, that you'll require hospitalization or have a severe course.
Because it's been always our motto on the show. It's all about the messaging, because I thought very early on messaging was wrong and it had to be rebuilt, and even some of the messaging now, and I'm just putting it out there because it kind of equates to these questions that I've asked you, and that is, we know that the vaccines, nothing is 100% perfect, but some of the message that comes out from some of our officials, I kind of step back, because when you have lay people that don't know any better, like myself, I'm just a lay person. I'm not a doctor. I'm not a physician. But if you give me with a vote of confidence, what you're telling me is that certain things happen, and then I see other things happen, then, that's when the lay person starts to question a lot of things. And I think for us, in getting everybody on board, we have to be marching to the same tune, because right now it doesn't seem that way. And the last question I had is, being knowledgeable with vaccines, how many attacks can a person take? Can a fully vaccinated person withstand? Meaning, if they're constantly exposed to this virus, right? Especially like you said in one of your scenarios, that if you're fully vaccinated, you can go to a family that's not vaccinated. So say you go there and say the entire family is sick, or maybe to the point that maybe pre-symptomatic as opposed to symptomatic, and they're just, their viral load must be, who knows. How many attacks can a vaccinated person take?
I think, I'd be curious to hear what Blanca says too, but my short answer would be there are so many variables even to that question. Like, every individual carries a different viral load. Everybody has a different susceptibility. Once you've been vaccinated, the efficacy of the vaccine within your symptom is very variable. Are you standing 3 feet away from someone versus 4 feet away from someone? The radius drop off from the spread is very significant, right? So there's so many variables to just a simple question like that it wouldn't be that's why, rather than say like, well, once you've been vaccinated, you can stand 3.4 feet away from a person for 7 minutes, but not 8 minutes. We just don't think of it that way. So the best practice continues to be, let's be responsible and let's err on the side of caution, right? Let's hang in there for a little bit longer. And we think that we're going to see good things happen if we do. Blanca, any thoughts on that, or anything further on that?
No, I think we've just been a few months with the vaccines in our populations, because that's something else. Like, the vaccines were tested in many different settings, and it helped many different people in many different populations. Here in Hawaii and Kauai, we've been with the vaccines like 4 or 5 months. So we still need to learn a lot of things about these vaccines. I always tell my friends and family, like, vaccines are really cool and everything, but they only work if we use them. So we're all excited about this new research. We're all excited about like how we're moving forward, how technology made all this happen. And we finally have these two among us that we get to use. And most people get to use, because it's not just a very few people that can get vaccinated. Like most people in Kauai can actually get their vaccine and continue protecting, their family members, their loved ones. And we do have family beyond Kauai, beyond Hawaii. So if we continue getting vaccinated, if we continue protecting our communities that way, then less likely we're going to have to deal with this virus in the future. So I think that's it can be scary because there are many things that we don't know. But I'd rather focus on the things that we know, on the things that help us move forward, on the things that protect our communities, and using all the tools that we have in our toolbox.
Yeah, I think we got to remember it's such a new vaccine. It's still a new virus, relatively speaking. This is not something that we've had the luxury of 40 years of study that we've seen every scenario. So right now, it's the matter of just being safe. And regardless if you've got the vaccine or not, wear your mask, social distance, wash your hands. I will say this though, and my dad is a good example. Again, he's actually watching, but we've had many experts come on the show to talk about vaccines and the virus, and he was not going to take the vaccine for his own personal reasons. And after listening to enough of the experts, and we've never had, including the two of you, we've never had guests that were trying to convince people with sharing the data. And I'm so proud of him that he eventually agreed to get the shot. So I think he's waiting for his second shot. So yeah, proud of you, Pops. I think we got our first shot relatively the same time. So, real quick question. This is a fun question. I think it's funny because I don't know the answer. Why is there a difference in the size of the cards of the vaccine? Do you even know? And if you don't know, that's cool. I just probably
yeah, it's probably not, and probably no fancy reason, just manufacturer or CDC being CDC.
And
yeah,
then,
if anyone knows, just let us know.
Yeah, let us know.
The same question.
Mel, I want to follow up on something you said though, Mel, about your dad and people like your dad. We spend a lot of time talking to those folks, and I want to be really clear that I don't think it's unreasonable to have questions, right, or to not be convinced right away of something. It is totally new. It is scary. It is unprecedented, and I think people don't want to feel shamed or don't want to feel pressured or don't want to feel rushed to make such important decisions, and so that's really not the position that we're in. We really want to make people feel comfortable and feel like they know where to go. You may be listening to us at home tonight and not be ready to make that decision, but now you know where to go for the latest info. If you're thinking about it in a month, and maybe most of the folks in your family have gotten vaccinated and nothing bad has happened, and you want to go back and you remember hawaiicovid19.com, and there's that info for you. The last thing that we want to do is shame anybody or browbeat anybody or convince anybody or arm twist somebody who isn't ready to do that. I really want to make sure that's clear. Is we're really here as a resource to help people make informed decisions about what's right for their health.
Now, there was a quick question about the Aloha Safe app. Is it working? Why don't we hear anything about it? I just want to say, Gladys, that is a peer-to-peer app. So that information doesn't get maintained or stored anywhere. It's a peer-to-peer. So you're not going to get that info. You're going to get the info if you subscribe to the app, or if you download your app, and if you come in contact with someone that is sharing their situation with their app, then you'll be notified. But that's the only people that get notified. So you're not going to get a report from the state saying, last week, Aloha app said we had, because the state doesn't know. The Department of Health does not have that data. So it's a very secure system. We had a show on that last week.
Oh, good.
We encourage everyone to download that app ASAP and get that thing working. So.
Do we know if, from the standpoint of vaccines and, well, first of all, the messaging, I go again, because, giving the option that if you've been fully vaccinated, you can meet someone without a mask, right? I would rather just say, just leave a mask on, because when you're in that position and you're so used to taking your mask off, there's going to be a point in time you're just not going to use your mask. And then I don't know if we have more problems after that or not, but it goes along the lines that monkey see, monkey do. And when you see a whole bunch of people looking at, how come they're not wearing a mask? Next thing you know, we have this revolt with local people because that's part of the problem that's going on now when they see all of our visitors walking down Waikiki with no mask, and yet every single time when it's asked, where did that cluster happen? Where was an infection rate? Or it was community spread, it was a local resident, and everybody starts getting upset again. So I said, hey, put out the messages, just tell them wear the damn mask. Don't even talk about not using a mask. But somebody asked this one question, and that is during the clinical trials for these vaccines, that it appears that the vaccines weren't used on those that had chronic disease like kidney diseases, cancer patients, and well, those type of situation. The vaccines now, do you think it would be safe for somebody who may be a cancer patient? That maybe they may be, I don't know if using the
So-
word remission,
There are specific counter recommendations, and you can go to the CDC's the form. We have the CDC form that has questions. We typically say if you're concerned, check with your healthcare provider. It's probably safer than us giving you medical advice on a webinar. But generally, I mean, we prioritize when we went into one. Was it 1C? We did prioritize people on dialysis, immunosuppressed people, and other people that were getting in transfusion therapy. So it is not specifically counter recommended, but if you are in one of those categories where you're not sure or you've heard a rumor or whatever, please feel free to reach out to a healthcare professional, your healthcare professional.
okay.
Do you know if okay, the one question was about the 6-month booster. I think Charlie talked about it early on before we went live that in some places they're testing or they're administering a third shot to some of the patients that were in the first trial program. Does it look like a third or a 6-month booster is probably going to happen, or is it too soon to tell yet?
I haven't heard anything about that. Blanca, have you? I mean, I've heard that there are trials, but I haven't heard anything about recommendations. I think it's one of those too soon to tell things. That's another question we get a lot is, do we have to get this annually now or whatever? And it's really just uncharted territory. Blanca, heard anything otherwise?
No, haven't yet. But if that's the case, that's more likely gonna come with your through your healthcare provider. So it's probably your doctor reaching out to you and telling you like there's gonna be an extra vaccine. Yeah, I don't think it's gonna be like the exact same effort that we're doing right now.
No pods.
I mean, I would assume at some point it'll be just like the flu shot, where you go to your doctor or you go to your pharmacy, you get your annual flu shot, or you just get another annual COVID shot.
It's actually, so the mRNA vaccine technology, my older deck used to be much longer and had a lot more about mRNA, but I think sometimes people ask like, well, if mRNA works so well and we've known about it for so long, how come we haven't been using it for vaccines before? And really the answer was that the conventional flu vaccine and a lot of our conventional vaccines were good enough, but the urgency to solve this problem in an expeditious way led to mRNA, led to, this is a technology that is much quicker to market, or actually should not to market, but is much quicker to from first idea of how to do this to actually being able to get it in arms. As I think a lot of people know, right, with a flu shot, it has to be cultivated over like a 12 to 18 month period. So there's a prediction game in it. You have to predict in advance what you think the dominant flu strains are going to be. And flu vaccines are in a good year like 60 to 70% effective. They're not, they're considered really good vaccines and they're only 60 to 70% effective. So the fact that this first round of mRNA vaccines was 90+% effective, 97% effective, is a harbinger for, maybe harbinger is the wrong word, but is a sign going forward that mRNA is going to be a really, really valuable way to address vaccines, because it means that you can adjust it seasonally. So if there are variants, as variants come online, I think in the future you're going to see mRNA going to be used in other vaccines and be much more effective than current vaccines are, and B, it seems like it's probably going to be much easier once the logistics of it gets sorted out to adjust the mRNA, the formula, right, or the photograph that it's actually responding to, and make it responsive to variants if that becomes necessary.
As if you know this one, I don't know, I haven't heard of any, but are fully vaccinated people, do they get tested if they are exposed to, if let me see, okay, let me just hypothetically, someone gets exposed, someone tests positive, they do the contact tracing, and it traces back to someone that was fully vaccinated. Do you know if those people are getting tested? The Department of Health, is the Department of Health requiring those contacts, even if they were fully vaccinated? Do they need to
So
get
if you answer the phone and say, and the contact tracers are calling you and they say, we have been notified by someone that you're associated with that you were in close, we think that you may have been in close contact with this person. At that point, you are no longer, so there's a course of questions and then a quarantine recommend or self-isolation recommendation that would follow, and they would log that and make sure that people are complying and give some resources, obviously. If you have been 2 weeks fully vaccinated, you no longer have to go through the self-isolation process if you are notified of contact.
Got it?
Yeah.
Only if you don't have any symptoms.
If you're,
So
yes,
if
correct.
you develop any symptoms, we're going to ask you to please quarantine yourself and take the test and all those things. Yeah.
Got it. All right. Let's see. Any P1 variant? These are just questions I wrote down as this thing was scrolling like crazy.
Mhm.
There's some questions in there that obviously is for another night, but I'm just trying to pick the ones that I believe you folks can answer. P1 variant and vaccines. And you may have answered this earlier, but do we feel like the Department of Health feel like we're in a good position to address the P1 variant as it makes its way across the country?
I haven't heard otherwise, there has not been any internal discussion that otherwise to the other effect.
Okay.
That's pretty much.
HawaiiCovid19.com.
Yes.
The statistics that you showed earlier with the percentages of each county, was that from that website? Was that, can you get that?
You know what? It is. It's linkable on there. I can put a direct link to it. We have a couple of different, our disease investigation, disease outbreak control team, DocD, is where that lives. I can put a link to it in the chat. That'll make it a little easier to find.
Yeah,
You can.
please. I got to be honest, and I mean, no offense to anyone, but it's that health department website can be overwhelming.
It certainly can. It's a lot of information, and no matter which way you slice it, I think there's so much information.
I know Charlie will agree. I will find what I'm finally looking for, finally find it, and then I forgot how I found it, and I cannot find it again for the life of me.
Well, I would say too, we're totally open to feedback. Nobody's defensive about it. It's a triage, right? This is a triage situation. We've all been working really hard for a year. We know there's room to improve. Nobody's ever done anything this big before. So we get feedback a lot on like, hey, why do you put this here instead of here? And we'll move it if it makes sense. Hearing from the public about things is a really reasonable way to get it. So, but when you do this, then that makes this thing harder too. So sometimes there is a method to the madness, but yeah, I can certainly put the data dashboard up. It's a really great resource.
Check the post right now. Katie Arita Chang just posted the link.
So, oh, great.
Thank you, Katie. Thank you.
So to add to what CJ just mentioned, so yeah, it can be overwhelming. As Mr. Raposo was saying, it can be. If you are ready to make an appointment and you live in Kauai, go to kauai.gov/vaccine. And then you will find the most up-to-date information right there. Like you won't have to fish for anywhere else. You just go there, find information for your vaccine as soon as you're ready, and make your appointment.
And I do want to say that for most of our viewers, just to let you folks know, this is a statewide. We've got pretty much even amongst from Big Island all the way to Kauai. So a lot of times, in fact, we got a lot of Honolulu viewers on tonight that's watching. So that's why we sometimes we just have to make that disclaimer so everybody understands and not just address one island, because a lot of the people are looking for information. Now let me ask you about your the vaccine programs that have been, the rollouts that have been handled by the hospitals like healthcares like Kaiser, HPH, Queens. How have those programs, are they somehow tied into the information? Is it tied to Department of Health as well?
So the best way to think about it is that for the most part, and there's some exceptions to this, but for the most part, the state receives an allocation from the federal government that's based on our population. And then from there, we allocate out to partners that have the capacity, that have established and demonstrated the capacity to hit the target. So we we have defined targets for where we want to be and for how many folks we want to try to get vaccinated. So these healthcare partners like your Kaisers and Queens that you mentioned, and also another big one, another really important partner that I don't think we hear enough about is our federally qualified health centers, or our FQHCs. Most people call them community health centers. So they're places that sort of by definition serve communities that have been underserved by other health systems, that have the disparities that we talked about a little bit earlier in terms of health outcomes. A lot of times they're race-based disparities or socioeconomic disparities. So those partners actually receive a dedicated supply, and actually that has increased for most of them in the last couple of weeks through an additional federal partnership. But we regard the FQHC partners as a really, really important part of how we are sort of addressing the inequities and the difficulties of access. But essentially, we receive it, we manage some sites. There's some sites where the allocation goes directly from the department to folks that we have contracted with or work with to get shots in arms. And in other cases, they go to these partners, and the partners have the staff and the resources and the infrastructure to do it. That's getting more complicated every day. As more supply is out there, I think that really early on, there was this desire to have these larger pods where you could have as few volunteers as possible and as few staff as possible, and have a centralized distribution system where people would just come in and get out and move a lot of people, right? It was a kind of an economy of scale. And as we've gotten further into this, what we're seeing is there is a lot of benefit to having a little bit more distribution and having more smaller and pop-up events and meeting people more where they live. And that's especially important in immigrant communities and communities where folks maybe don't speak English as prominently, or just don't have a historically great relationship with the healthcare system. Getting out to churches, I mean, there's been a lot of like, let's just set up in a church parking lot and have people come out there and get vaccinated there. So there's so many different ways right now between the FQHCs and the large pods that are run by us and by our healthcare partners, to these small mobile units that are hitting unhoused people, or our pharmacy partners have been doing actually that's another big success story, is the long-term care facilities are essentially fully vaccinated right now in our state. We're like 90+% of long-term care facility residents, nursing home residents. And then they're actually, at this point, our pharmacy partners are doing home visits for homebound people as well. So there are many, many, many different channels. And that's part of what makes it complicated, I would say, is I think we are working towards, I think everybody has a hope that there's will be a one-stop destination where you can go and easily register, and it'll spit you at the place that's easiest for you to get to. And it's a hard thing to do. You'd be amazed how complicated it is to work with, the healthcare partners and the clinics and the one-off providers and the small folks, to create one central location. And it is a big challenge. They all run their own registration. They all have their level of phone versus internet support for doing all that. So it's tricky, it's complicated. We're always looking for little efficiencies, little ways to make it easier for folks.
Okay. I know we're running out of time. We're running out of time. The Johnson & Johnson, that I know there was some concern about supply, but that I'm sure that's going to be resolved. But that's only available through the Department of Health and not through the hospitals, correct? I don't know about the rest of the state, but I know in Kauai, when I went to try to get a Johnson & Johnson from our hospitals, that option was not available. It was only available at the the convention hall. Blanca, you know anything about that as far as Johnson & Johnson? Is that only available through the Department of Health?
Right now, you can try to check with the pharmacies. It's a little bit hard to, as CJ mentioned, it gets complicated. So it's a little bit hard to keep up on who has vaccine supply right now and which kind of vaccine supply they have. The best option, the best shot is try to log into each one of the like websites, and when you make the appointment, you have information about the vaccine that you may or may not receive. The hospitals do receive Pfizer, so they do not have access to Johnson & Johnson. Our community health center had some vaccines for Johnson & Johnson as well.
The Vaccine Finder app, the vaccinefinder.org that I shared earlier actually lets you search by which vaccine you want to get. So you can enter your zip code and it'll show you a map and it'll show which vaccines are available where. And again, it's, because there are so many sites, and that's primarily retail pharmacy partnerships, which I would actually say that's something I forgot to mention earlier. We're really would encourage folks who are able to try to find a retail partnership, a retail pharmacy partner that works for them. They're obviously very low resource for the Department of Health, and that allows us to focus on higher resource populations and places where folks don't have that option. It's maybe harder for them to get to someplace, or they have mobility or language barriers or whatever. So anybody that can use a retail pharmacy partner, most of them seem to be having a lot of availability if you look a little bit down the road. And then the other thing is, if you are in one of these, so I know you have an Oahu audience, if you are in one of these eligible groups that's not general public, register this week. Try to get in this week, because it's going to be harder starting on the 19th. It'll be more difficult to get a slot. So if you're on the fence, if you're thinking about maybe now's the time to do it, jump in and get a slot. Try vaccinefinder.org.
Vaccinefinder.org, people. Good resource. Also, I saw earlier, this will be my last question, but you mentioned in the presentation 211 for people that don't have computers or can't get online, or if someone has a kupuna that may be living and don't have internet. 211, does that work statewide?
211 is statewide, and it does have language support. They have on-call interpretation. So if you have language concerns, or if you just want to make it talk on the phone, we can get you that way.
Okay, viewers, if you have that auntie or grandma or tutu somewhere that no more computer, call them tonight. Tell them call 211 tomorrow, and they can talk to a human. Hopefully, it's a human, right?
It's a human.
Okay.
And they'll help with transportation if you need transportation. They'll help if you're homebound. They can get you in the queue for a home visit. They screen everybody and make sure everybody gets the right resources. So yeah, it's a good service.
211. Awesome. Any closing comments, Chris and Blanca, before we get out?
I would just say real quick again, what I started off with is we're really interested in making sure that community leaders, folks that have access and have influence over populations that are not convinced, that are not sure, that have some concerns. We're happy to set up some small meetings. We've done a lot of pastors groups or Catholic priest groups or other faith leader groups, and just had small closed conversations that weren't broadcast, where people could ask questions and we could make sure that we understood what the concerns were so that we could plan accordingly. But please feel free to reach out to us. We're really happy to engage one-on-one and small groups, however it will help you help your congregation or the community that you serve make informed decisions. We're available for you. So thank you so much for having me.
Awesome. Blanca.
Thank you. I think that someone else was asking me what can I do to continue moving forward with this effort, and I was thinking the easiest process is we all know someone who's almost ready to get the vaccine or doesn't know how to get the vaccine. So if if English is their first language, and we all know someone whose English is not their first language, so reach out to them, ask them do you want your vaccine? Can I help you make your appointment? Offer transportation to them, help them navigate the system, because computers and smartphones are not as easy for everyone as it is for kids right now. So I would say just offer your help if you can, and try to assist family, friends, anyone who is around. And if you are in Kauai, just reach out to the Department of Health. We're more than happy to try to meet you where you are in terms of needs. And if if the 211 line doesn't have answers for you, if you're in Kauai, you can also reach out to the Agency on Elderly Affairs too, and they are very up to date in terms of resources and information here for vaccination as well. And no, thank you so much, really, for the space.
Thank you, Charles.
Well, thank you to our guests. I think it was very informative on the vaccines. I do know that it was about a week ago, the head of the Health Association, that gentleman that kind of speaks with that English accent, he did have just one drawback, and that was the availability of vaccines. But based on what I hear tonight, that shouldn't be a problem moving forward. So I think everyone who's watched tonight, just know that the availability is there. and you just have to go out and seek, and thou shall find, as they say. So thank you very, very much.
Thank you for having us. Appreciate it. There you go.
Blanca.Baron at doh.hawaii.gov, Christopher.Johnson3 at doh.hawaii.gov, hawaiicovid19.com. For those of you on Kauai, kauai.gov/vaccine. Guys, information is important. If you're on the fence, talk to these people. You know, get your questions answered. Not at the University of Google or Facebook University. Talk to the experts. Get the information you need to make an informed decision. And like Charlie and I say, we will never hold anyone or hold it against anyone if they choose not to get the vaccine. We strongly encourage you get it. But please get the info before you make a decision not to take the vaccine. All right, guys. Now is the time. It's more important now than ever to stand together, get healthy, get safe, so we can battle this crazy COVID. So again, thank you to Chris and Blanca. It's Blanca, not Bianca. What's the Baron, Blanca? What's the Baron?
That's the past.
Oh, sorry. That's my son's name. That's why. That's my son's name. Charlie,
Blanca Hill.
Stop asking that kind of stupid questions, Mal. You don't put on the spot. Okay, forget. We can delete that. We can edit that out. No, we can't.
No, but
Right.
the email is correct.
Okay.
But yeah, it's Blanca. Thank you so much.
Blanca, thank you, folks. You guys stay safe. God bless you guys. Keep up the good work. We appreciate what you
Appreciate
guys
it.
are doing. And maybe get you guys on again one day soon. Take care. God bless.
Anytime. Yeah. Take care.
Aloha.